this topic is one that, you know, some people try to avoid discussing, but we're going to actually talk about it today.
Yes.
Urinary tract infections, or UTIs. Those are infections that occur in any part of the urinary system. That's the kidneys, the bladder, or the urethra.
And I think that's about as much as we probably know. And so to enlighten us, we have General Health Practitioner Dr. Olatunde Kuti is joining us to tell us more about UTI, its symptoms, and treatment, of course. So great to have you on the show, Dr. Kuti.
Good morning, doctor.
Good morning.
Oh, goodness, we can't hear the doctor yet. Okay.
Oh, great. Fantastic. Okay, so great to have you on the show. Thank you so much for joining us.
It's a pleasure, always on the show.
Absolutely.
Okay. So I think we should just start with how to even identify if someone has a UTI. What are the first indicators when someone comes to your doctor's office and complains?
The common symptoms of UTI is, number one, frequency. What we mean by frequency, the person goes to toilet more than often. So every, let's say, 30 minutes, 1 hour, you are pressed, you feel like going to the toilet. There's something we call urgency, inability to hold your urine. So when you are pressed, you just want to go to the toilet and urinate immediately. Then there's also what we call dysuria. There's pain while urinating. You're not supposed to feel pain while you're urinating. So when you start feeling pain, that burning sensation, it's called a burning sensation while urinating. Those are the common symptoms of UTI. However, there are more. So,
Go ahead, please.
Okay, however, there are more, which we call the complex UTI. So those symptoms I mentioned earlier, that for the simple UTI, but for the complex UTI, when you start seeing blood in the urine, you have fever with chills, there's back pain, or there's a flank pain. Those are also symptoms of the complex UTI, which is more serious than the simple UTI.
Okay. You know, when we talk UTI, many people always think it's a girl thing or it's a female disease. What many people don't realize is it's a unisex disease. However, for both sexes, how can you identify it? Is it the same symptoms or it differs?
The same symptoms for both sexes. And yeah, to correct that, UTI can affect both male and female. Young and old can affect everybody. Though it's commoner in female. We found out that females have UTI more. But the symptoms is basically the same thing in both sexes.
Okay.
So, Doc, where exactly could someone get a UTI? So what are the most common causes of urinary tract infections?
Urinary tract infection basically is caused by the most common bacteria that causes it is called E. coli. So when you have a urinary tract infection, it's a bacterial infection. It's a bacteria that is causing the infection. But there are predisposing factors that will make the bacteria cause the infection. So things like why it's common in females. Females have a shorter urethra. There's something called urethra where you urinate from. The female has a shorter one, which is very close to the vagina as well as the rectum. Because of that close proximity, organisms can get easily into the urinary tract. Then you not urinating on time, holding the urine for a long time, what we call stasis. So you are pressed because you are doing something at work or something, you don't go to the toilet for a very long time. That can also cause, predispose you to the bacterial infection. Then you not taking adequate water, dehydration can also predispose you to having the bacterial infection. And for some reasons, in females as well, hormonal changes has also been attributed because females undergo different puberty, menstruation, and everything. So the hormonal changes alter the balance, the pH, the acidic pH of the vagina, which is supposed to be protective against bacteria. But when that pH is, that acidity is altered, it can allow the bacteria to grow and easily get into the urinary tract infection. So basically, those are the common predisposing factors.
Okay. Dr. Kuti, you know how it is when they say prevention is better than cure. So before we talk about the cure, can we talk about ways to prevent UTIs?
First, most important thing you need to do is take a lot of water.
Okay.
You taking a lot of water would help you prevent UTI because it's going to wash away the bacteria from the urinary tract. Then do avoid holding your urine for too long. Stay pressed. Make sure that you go to the restroom. Then for females, especially those that are just married, there's a common UTI called honeymoon cystitis. It's usually very common when for newly married couple because because of the new sexual interaction that they are having. So we always advise that if that's the case, the lady should take water and go to the restroom few hours after interaction with the husband. Then all the other things they do as well. Cranberry has been shown to also help a lot with preventing UTI. So you can take the cranberry juice as much as you can, which will also help you flush out the bacteria and prevent you from having urinary tract infection.
Oh. All right. Now, I'd heard about the cranberry. You know, there are even cranberry tablets now that have been designed for things like this. But I wanted to talk a bit about the myths. So a lot of times, you know, you hear older women tell younger women, oh, you know, it's you got it from the toilets you're using in public, or maybe you didn't use the right type of detergent to wash your underwear, or maybe you didn't rinse off the detergent from your underwear properly. Are these all myths, or are these actually true?
Not true. They are not true. Basically, let me use this medium to clarify the fact of toilet infection. Basically, there's nothing like toilet infection actually. So people just say, oh, I think it's the toilet that's causing. No, it's not the toilet. I've already explained the predisposing factors earlier. Females is common in females, especially people that are sexually active. Okay. Females that are sexually active, they tend to have UTI a lot and not careful. So those are common things that can predispose you to UTI, not the toilet you use and not whether you're washing your underwear. Though you know washing your underwear can cause another thing, but not particularly UTI.
Okay, so as quickly as possible now, let's talk about treatment. The first thing you advise your patients to do.
Once you have those symptoms, make sure you visit a doctor, and it's very advisable that you undergo a test. We call it, the best is called urinary MCS culture. So they take your urine and they grow it in the lab. So we try to identify the organism that is growing, and once we can identify the organism that is growing, we test it with the antibiotics that is best to treat it. So once that is done, what you just need to replace your antibiotics, tell you to take a lot of water, and yeah, you're fine. However, for anybody that has UTI at least more than twice in a year, it's usually advisable that you visit the urologist. Those are the people that take care of urinary tract infection, because what might be going on might be more than
what is being made of.
Okay. All right.
Thank you so much for your time, Dr. Kuti. We've learned quite a bit. Thank you so much. Hopefully we'll do this some other time. Well, we have to take this break right now. Wake Up Nigeria continues.